Good afternoon and welcome to our virtual residency graduation for 2021 at Prisma Health Midlands. I'm Dr. Chuck Carter, your Regional GME Executive and DIO, and I want to welcome you and congratulate you on this important milestone. I'm sure when you entered residency or fellowship, you didn't necessarily anticipate that half of your experience would be defined by a pandemic. And I hope as you look back over time, you do not feel that it was totally defined by it, because you still had a quintessential residency experience. You learned new things, you created new knowledge, you developed crucial professional relationships with faculty, long-lasting friendships with peers, and you made a real impact on the lives of patients and our system. So for all that you've done during an enormous and challenging time, I want to say thank you. And I also want to, in advance, hope to say that if you're staying with us, we're very glad that you've chosen to do that. If you're not, we hope in advance to welcome you back someday, because you're part of our family and you've made an enormous contribution to the lives of the patients here in the Midlands of South Carolina. So, and again, thank you for all of your service. Thank you for all your flexibility and creativity and all you've done during a very challenging time, and one that you won't easily forget.
Hello. What an exciting day. We are so proud of all of our graduates today. We know that you, as residents, you have had a tremendous experience at Prisma Health, and we are just couldn't be prouder of what you have really experienced and what you have learned while you were here, but more importantly, what you have contributed to Prisma Health. We are very proud to say that we have over 106 residents and fellows in our upstate area. There's 115 in the Midlands, which gives us around 221 total graduates. And we couldn't be prouder of each and every one of you. We want you to be aware that we know that while you have trained here, you have practiced here, we know that you are going to go forward and do great things. We are so proud that we have been able to retain a number of you here in Prisma Health and in the state of South Carolina. And we also know that some of you are going off to fellowships, some are going off to other areas to practice, and we are so proud of you. And we know that you will take Prisma Health in your heart no matter where you go. We want you to know that Prisma Health, we are committed to creating a better state of health for South Carolina. And if we haven't learned anything else during this pandemic, we know that healthcare does not stop at the borders of the state. So while you are training at Prisma Health and experiencing your clinical learning throughout our system, we know that no matter where you go to practice, we hope your experience with us has been one that will take you far. I think you're also aware that at Prisma Health, we are a very unique academic health center. In other words, we are a health center that is led by the health system. We have academic partners, however, with Clemson University, Furman University, and University of South Carolina. And we know that some of you actually have graduated from our University of South Carolina medical schools. We're very proud of who we are as academics because everything we do is focused on the patient. So as we have worked with Clemson University in the nursing program, it's really about training and educating nurses who will be positioned to practice when they complete their training at the bedside. We're affiliated with two medical schools, both the USC School of Medicine here in Greenville and the USC School of Medicine here in Columbia. We have a strong pipeline program through our Medics Academy program, a number of allied health programs and advanced practice professionals. We're also very, as you well know as graduates, we know you've had a chance to experience the research we do here. And we know that you see research here at Prisma Health very different from traditional academic research because everything we do is studying what's going on with our patients. Thanks to each of you as you are planning for graduation, for everything you have done to contribute to our research enterprise. We also have over 8,000 students coming into our clinical learning environment annually. Many of you have touched these students, whether they're medical students or students coming in for other experiences. We know you have shared the clinical learning environment. And on this day, we are so proud to say with our GME program, We are 52 residency and fellowship programs strong. We're so proud of our training programs, with over 600 residents and fellows in our system annually. So again, as you graduate, just know that you're leaving a system that you have others coming on behind you, and we're committed, Prisma Health is committed to our GME programs. As you think about Prisma Health academics, another takeaway for you, as I hope you have experienced, is we are laser focused on our workforce. We know you as residents, as you are graduating, no matter where you practice, you're going to contribute to the workforce. We are so proud to say that as we look at our workforce and our GME programs, we're intentionally trying to recruit you from day one. So if you're going away for a fellowship or going elsewhere to practice, we hope you'll remember your experience here at Prisma Health and one day come back here to practice. Prisma Health, I want you to remember, as we think about academics and our investment, our largest investment is in you, is in each of you as our residents and our fellows, because we recognize the opportunity we have to train and retain the best and the brightest. So thank you for being part of that pool of students to come through our training program this year and before. You are absolutely critical to Prisma Health's goal. If we're going to truly create a better state of health for South Carolina and beyond, we need you as residents. We need you now as you enter into the practices of Prisma Health across the state and beyond. We need you if we're going to create a better state of health for our patients and our communities. We know that as our graduates, you have received state-of-the-art training, and we are so proud of that. We know that you're ready to care for patients who are coming in with complex problems. We know that you are ready to be at the front line because as you have completed your training here, you've had a chance to not only be trained, but you've had a chance to practice alongside some of the best and the brightest. And we're proud of that because we are able to hire tremendous faculty and tremendous physicians across our system because you are part of our enterprise. And that whole idea of giving back to the next generation, I think, is what excites so many of our faculty and physicians across the system. So as residents, we know that you are heavily or have been heavily involved in our patient care here. We know you work 24/7, 365, and we appreciate that. We know that you have been involved as graduates with our quality and research projects across our system, all focused on patient care. We also know that our GME programs here at Prisma Health really positions us well as we continue to grow and look at the growth strategies for Prisma Health. We know our GME programs will continue to attract the best and the brightest among the residents, among faculty, and others who touch our clinical learning environment. So bottom line, Prisma Health invests in you because you make us better. We are so proud of each and every one of you. We wish you the very best, no matter where you're going to practice. We hope that your experience, your training, and your hands-on care with your patients have been stellar. And we hope that you will always keep Prisma Health in mind, no matter where you go to practice. Thank you.
Good afternoon. I'm Mark O'Hala, President and CEO of Prisma Health. On behalf of the Board of Directors and myself, we would like to offer all of you a sincere congratulations on this milestone accomplishment and exciting transition in your careers. Residency graduation is a remarkable achievement. In a year like no other, filled with stress, disruption, and uncertainty, you all have gone above the call of duty to meet the pandemic's many challenges. I hope this year reminded you why you decided to choose medicine. Responding to a crisis and ensuring a community's health needs are met is what we do. This is why we are here, and I know you will carry the learnings from this experience into your future careers. In an academic healthcare system in a normal year, residents serve as an indispensable resource to the entire team. During a pandemic, I especially want to recognize the remarkable strength of our house staff for their tireless support of our patients and team members. Prisma Health is proud to recognize the service, dedication, and growth of all of you. Thank you for your commitment to our patients, each other, and the communities we serve. As you close this chapter of your academic careers and transition into your new professions as fellows or physicians in a practice, we hope you will take with you the purpose to inspire health, serve with compassion, and be the difference. On this special day, we celebrate the graduate medical education class of 2021. The long hours have paid off. You've done a phenomenal job, and you should be incredibly proud of all you have achieved. Congratulations, and we wish you all the best of luck in your future endeavors.
Each year, we're privileged to have peer residents who are elected to serve as resident council officers and represent all of the residents and fellows across our Prisma Health Midlands programs. These residents take extra time and provide a voice for all of their peers. And particularly this year, I want to show a lot of gratitude for them for being flexible and communicative during a very challenging time as we face the ongoing COVID pandemic. So with sincere thanks, I want to recognize our four Residence Council officers. Matt Jones from the Department of Surgery served as the president. Justin Humphrey from Internal Medicine served as the vice president. Elizabeth Ramsey from Internal Medicine as the secretary, and Courtney White from Internal Medicine as the treasurer. These four individuals did an enormous job and really went above and beyond during a challenging time. And again, congratulations and thank you for your service during this year.
Hello, I'm Renee Connolly, Director of Graduate Medical Education, Learning and Development, and I have the pleasure of facilitating our resident-led ethics series. This case-based series was established 12 years ago to fulfill a resident-identified need for more practical knowledge of ethical dilemmas during the training years. It is led by residents and fellows and includes professionals across the system from risk management, legal, nursing, pharmacy, social work, chaplaincy, and our attendings. The series has grown to include a surgical and medical cohort with 12 programs that are involved annually: dental, hospice and palliative medicine, general surgery, OB/GYN, ophthalmology, orthopedic surgery, plastic surgery, family medicine, internal medicine, neurology, pediatrics, and psychiatry. A few years ago, the GME office established this award to honor the 10-year anniversary. In this, the third year of the award, nominations were accepted from students, professional staff, medical staff, clinicians and providers, and residents and fellows. The award is open to any resident or fellow. On behalf of the GME office and our programs, I am pleased to present the four residents who were nominated and then announce the 2021 winner. In alphabetical order, the nominees this year are Dr. Cecilia Favade, PGY 1 in Pediatrics. Dr. Michael Gibbons, PGY 3 in General Surgery. Dr. Amar Hashmi, PGY 2 in Internal Medicine. Dr. Matthew Jones, PGY 4 in General Surgery. Thank you all for the work you do every day and the ethical dilemmas you handle with fairness, grace, and patience. The winner this year of the 2021 Resident Fellow Award for Outstanding Ethics in Practice is Dr. Amar Hashmi in Internal Medicine. Congratulations.
The Darlene S. Norton Program Administrator Award recognizes program administrators who set the bar for success. They embody leadership, teamwork, and professionalism, and really make a difference in improving resident and fellowship training by going the extra mile. They inspire others by taking the lead in change innovation, special projects, as well as role modeling and mentoring new program administrators. We're so fortunate to have a wonderful program administrator team, and many inspiring nominations came forward from the GME programs expressing their heartfelt appreciation. This year, we're pleased to announce the program administrator who has been selected as recipient of the 2021 Darlene S. Norton Program Administrator Award. Lori Collins, Program Administrator for Cardiology, Pulmonary and Critical Care, and Critical Care Medicine Fellowships. Congratulations to Lori for this recognition of her outstanding contributions in her training programs across the GME community locally and nationally. Congratulations.
Each year, the University of South Carolina School of Medicine third and fourth year medical students honor resident physicians who have served as exemplary teachers and role models throughout their clinical training. Today, I am pleased to announce two Prisma Health Midlands residents who have been selected as recipients of the 2021 Resident of the Year Teaching Awards. The resident physician selected by our graduating M4 class of 2021 is Dr. Zach Webster from the Department of Internal Medicine. Dr. Webster is preparing to begin his PGY 3-year at Prisma Health in July. The resident physician selected by our M3 class, the class of 2022, is Dr. Angelo Sarmiento. Dr. Sarmiento is completing his preliminary medicine year and will be starting his ophthalmology residency at Cook County Hospital in July. I want to offer my congratulations to both Dr. Webster and Dr. Sarmiento for this recognition of their outstanding contributions to medical education.
The emphasis that Prisma Health places on humanism and medicine is enhanced through the Prisma Health Midlands Resident Physician of the Year Award process. One of the approximately 300 residents and fellows is recognized annually at the Prisma Health Midlands graduate ceremony for outstanding achievement in high-quality humanistic patient care. The prestigious award serves as an incentive for all residents and fellows to develop and exhibit traits that support Prisma Health's purpose statement and, in turn, become caring physicians who are prepared to deliver humanistic patient care in the environment of the 21st century. Training and graduate medical education programs has traditionally focused on the development of clinical and procedural skills. Until recently, accreditation bodies have placed little emphasis on the development of humanistic qualities. Despite the lack of external emphasis, however, Richland Memorial Hospital developed a tradition of stressing humanism and medicine, which is now embedded in Prisma Health's commitment to graduate medical education. The importance that Richland Memorial has placed on developing these qualities in its residents provided a head start in addressing the 6 core competencies that the Accreditation Council on Graduate Medical Education expects in all residents to acquire as a condition of completing their residency training. Indeed, half of these competencies emphasize humanism in the delivery of medical care and are reflective of Prisma Health's purpose statement. Inspire health, serve with compassion, be the difference. Among those specific competencies, patient care that is compassionate, appropriate, and effective for the treatment of health problems and the promotion of health. Interpersonal and communication skills that result in effective information exchange and learning with patients, their families, and other health professionals. And professionalism, as manifested through a commitment to carrying out professional responsibilities, adherence to ethical principles, and sensitivity to a diverse population. The Prisma Health Midlands Resident Physician of the Year is selected based on how well he or she exhibits Prisma Health's purpose statement. The selection process begins with each residency or fellowship program director completing a nomination form that provides specific examples related to each aspect of the purpose statement. A work group from Midlands Graduate Medical Education Subcommittee evaluates these nominees and recommends a selection for Prisma Health Midlands Resident Physician of the Year. The nominees for 2021 Prisma Health Midlands Resident Physician of the Year are Anna Alapat, Obstetrics and Gynecology. Sarah Battle, Infectious Disease Fellowship. Bradley Edmonds, General Psychiatry. April Hobbs, Pediatrics. Zachary Hunter, Emergency Medicine. Ashley Ludwig, General Surgery. Elaine Rennick, Family Medicine. Sheen Rivera, Child and Adolescent Psychiatry. and Christopher Zust, neurology. We would first like to say congratulations to all of these nominees for being recognized by their individual specialty areas as their nominee. All of the nominees this year were excellent, and as we have found in previous years, it was a difficult decision to make. This year, a year none of us will ever forget, we are pleased to present the Resident Physician of the Year Award to Dr. Anna Alapat from Obstetrics and Gynecology. Congratulations, Dr. Alapat.
It's my pleasure to recognize all of our residency and fellowship graduates at this time. From the Department of Dentistry, Meade Lyons, Emily Phillips, Samuel Ramey, Laura Strait, Laura Thompson, Cassidy Wolf. From the Department of Emergency Medicine, Zach Bowl, Brooks Briel, David Carl, Trin Chu, Stuart Couch, Tyler Goldbach, Zachary Hunter, Stephen Kostelik, Elizabeth Rossich, Jimmy Turner, Paul Vandekuppel, Evan Wheeler, Clay Winkler, from the Department of Emergency Medicine Global Health Fellowship, Daniel Baker, from the Department of Emergency Medicine Emergency Medical Services Fellowship, Garrett Snyder, from the Department of Family Medicine Residency, Matthew Gleaton, Wynn Harvey, Mohan Natrajan, Michael Oler, Mai Palm, Ashley Pierce, Elaine Rennick, Luke Spangler, Adam Verhoof, Daniel White, from the Department of Family Medicine Sports Medicine Fellowship, Jackson Dimler, Thomas Kellum, from the Department of Internal Medicine Residency, Andrew Aruka, Brian Berry, Mir Fakhri, Thomas Falaise, Scott Harrington, Justin Humphrey, Arjun Jadhav, Kayla Lefevre, Gia Lee, Johannes Nagash, Ajit Roy, Samuel Skoma, William Sessions, Justin Sue, Priscilla Yee, from the Department of Internal Medicine Intern Program, Emmanuel Sarmiento, Alexis Wallace, from the Department of Internal Medicine Cardiology Fellowship, Michael Rawfield, Jared Sargent, from the Department of Internal Medicine Endocrinology Fellowship, Matthew Rosner, from the Department of Internal Medicine Infectious Disease Fellowship, Sarah Battle, from the Department of Internal Medicine Infectious Disease Hepatitis C Fellowship, Alexander Milgram, from the Department of Internal Medicine Pulmonary and Critical Care, Andy Ariza, Stephen Templeton, Matthew Varner, from the Department of Neurology, from the Department of Neurology, Nicole Hogan, Shraddha Patel, Christopher Zust, from the Department of Neurology, Vascular Neurology Fellowship, Nishant Kudamuri, from the Department of Obstetrics and Gynecology Residency, Anna Alapat, Leanne Gosmeo, Jennifer Higdon, Nivedita Umasankar, from the Department of Ophthalmology, Ophthalmology Residency, Lauren Dubonnet, Caleb Story, Edmund Wright, from the Department of Orthopedic Surgery, Orthopedic Surgery Residency, Cody Hightower, Matthew Pukana, from From the Department of Pediatrics Residency, Elizabeth Beatty. Megan Brown. Elizabeth Bono. Say that again. Alyssa Bono. Rachel Birch. Kelly Davis. Joshua Godwin. April Hobbs. Heather Lynn. Christina New. Paige Patterson. Dalton Rennick. Kelsey Snedeker. From the Department of Psychiatry, Child and Adolescent Psychiatry Fellowship. Marcus Buthurum. From the Department of Psychiatry, Forensic Psychiatry Fellowship. Casey Gregoire. Laura McCabe. From the Department of Psychiatry, General Psychiatry Residency. Bradley Edmonds. Robert Flowers. Darian Namba. Jacob Poole. Courtney Sanchez. From the Department of Surgery, General Surgery Residency. William Gazzola. Scott Holt. Ashley Ludwig. From the Department of Surgery, General Surgery Intern Program. Adam Richardson. From the Department of Surgery, Surgical Critical Care Fellowship. George Pennington. As we conclude our graduation ceremony, I want to express my gratitude to you for all you've contributed to Prisma Health during your time in training. You've truly gone through residency or fellowship during a very unique time. As you go out, I want to share with you some recent thoughts that Dr. Thomas Naska, the ACGME President and CEO, recently shared with the entire graduate medical education community. Dr. Naska challenged us that through our roles as healers, we can establish a foundation for a civil and respectful society. This trying time that you've been in training with has seen both social and medical upheavals. I encourage you not only to consider these obligations part of the educational community, but all of the community of healers. Please go out and accept this challenge to heal not only patients, but the communities you serve and the communities they live in. Best wishes, and remember, this is always your home and we welcome you back. This is, of course, not goodbye, but until we meet again. Thank you.